This month, in our TAC Tic Talk, Jacqueline and I caught up with Applied Kinesiology Chairman and Functional Neurologist, Dr. Richard Belli, so that he could talk more about his article, Applied Kinesiology Approach to Vagus Nerve Dysfunction, which appeared in the October issue of the American Chiropractor. Great insights for this unique method of evaluation and treatment. Listen on. Welcome, Dr. Belli, to the TAC Tic Talk. So what we're doing is we're adding intervention to the print because you introduce so many concepts that some chiropractors may be familiar with, some may not be familiar with, some have preconceived ideas of what is going on that, it necessitates us delving deeper into that, right? Mm-hmm. So I'm, of course, the editor of the magazine. Jacqueline Touzard is my sister and the publisher. And so we have kind of diverse opinions on the topic. So that's why it kind of works, And then you, Richard, are the expert. So we're reviewing your article here, Applied Kinesiology Approach to Vagus Nerve Dysfunction, right?
Right.
So, well, and Dr. Joe, if I might jump in, because before even any questions, Dr. Belli, I'm sure people don't really understand your history. So give us a brief bio on you, because your years of experience speak volumes.
Well, I graduated from Life West in 1984, a long time ago. And right out of school, I started studying applied kinesiology. And then I was really turned on to it by somebody who became my mentor and who's unfortunately gone now, Dr. Wally Schmidt. And then Wally advised me to get involved in the functional neurology program. And so I started studying functional neurology under Dr. Carrick. Mm-hmm. And concurrently, I was also working on a graduate degree in exercise physiology. So things, really started coming together there. And I was in Dr. Carrick's program, and it just dawned on me that all these neurological pathways and functional systems have some sort of muscle function associated with them one way or another. And I found references that supported that. So I started this pursuit of kind of putting together all these functional neurological applications with muscle testing applications. So it's more like a manual muscle testing approach to functional neurology. Mm-hmm. And I've been working on my treatment system, which was affectionately named by my students who I teach it to, neurological applications of applied kinesiology, for about 30 years now. Mm-hmm. And it's gone through many different refinements and, it continues to grow as our knowledge grows. So that's kind of where I'm coming from.
Wow. Dr. Schmidt, of course, legend in functional medicine, rest in peace, right? And Dr. Carrick, of course, in functional neurology. So you had two resources that really shaped what a lot of chiropractors have become, right? And you yourself, clearly a legend in this with the work you've been doing continuously with your functional neurology as well as applied kinesiology. As I see, you have DACNB and FABNN after your name. Mm-hmm. So what are those certifications for?
The DACNB is a diplomate of American College of Chiropractic Neurology, and the FABNN is Fellow of the American Board of Nutrition and Neurochemistry.
Okay, so you've done your time on those topics, I'm sure, and passed the test, right? And passed the test, as they say. So, well, let's jump right in. At the beginning of your article, you paid homage, of course, to George Goodhart and the work that he did now. And you talked about some of the muscle testing, the manual muscle testing that is so reflective and important in the diagnosis side of applied kinesiology. Can you talk a bit about that?
Well, just like the reference that I provided, virtually every human function has a muscle function associated to it, because we as humans are all about movement. Everything we do is based on movement. Once we cease to move, we really cease to exist. So you can't even think of a thought without a muscle function being associated to it. For example, pupillary reaction. What I've done over the last decades is gone through and trust me, it's taken a lot of research and reading way more neurology material than I ever wanted to, just to try to figure out the muscle patterns that are basically associated to different parts of the nervous system, whether it be related to some sort of cortical motor aspect or basal ganglia, cerebellum, etc. So that's kind of where we're coming from on this. And then once you know the proper pattern and you test those patterns, and if they, as we use in terminology, normally display, then you know that that system's functioning pretty well. But if the normal pattern does not display, then you know you've got a dysfunction in that part of the nervous system or the brain. Now you use that pattern to figure out what's going to fix that dysfunctional aspect of the nervous system, whether it be a cranial fault correction, whether it be a neurochemistry correction, whether it be a manual adjustment. That's where the muscle testing and that pattern comes in handy, because then you can kind of go looking. That's what I tell my patients. They'll often go, well, what are you looking for? And I say, well, this didn't normally display. So that tells me you've got dysfunction in this area. So now we're going to go looking for something to fix that, to bring it back to normal. And then when that's brought back to normal, then your whole system comes up to a higher level of normal function again.
Mm-hmm.
So hopefully that answered your question.
Well, it starts to ask more questions, right? Of course,
Yes.
you focused a significant amount of attention on the vagus nerve. That was the purpose of the article, was to really tease that out. So, I mean, is that the most important effector of the central nervous system and peripheral, or is that?
Well, it's certainly the most important aspect of the parasympathetic nervous system. I mean, when I teach about the vagus nerve, I say the vagus nerve is at least 1/3 of your parasympathetic function, and it may be even more. And that's why it's so important. And the vagus nerve was brought to light about 15 years ago when a PhD, MD researcher, Kevin Tracy, discovered the anti-inflammatory aspect of the vagus nerve. They call it the cholinergic anti-inflammatory pathway, or the vagus anti-inflammatory pathway. So that really piqued my interest in all this, and in realizing that virtually every human malady we get nowadays has some sort of inflammatory aspect associated to it, especially all of our chronic diseases. So here the vagus nerve becomes a big player, because the vagus nerve modulates practically all inflammation in our body in one way or another. The more I learn about the vagus nerve, the more I see how we can use that to modulate musculoskeletal inflammation, visceral inflammation, brain inflammation, you name it. As a matter of fact, there was an article published, I would say 2 or 3, maybe 4 weeks ago, and the New Scientist magazine, about how our fascia is now considered by anatomists and physiologists to be an entire organ in itself, because our fascia produces neurotransmitters, inflammatory hormones, and it covers our entire body. Well, I've since learned that, when you figure out that there's a inflammation of the fascia, which can cause pain all over the person's body, diffuse pain, that can be easily corrected by correcting the vagus nerve. So again, it's another very powerful tool in overall function of the body. And it came to light to me. I always wondered. I've never been specifically an upper cervical practitioner. However, I've really appreciated the power of the upper cervical adjustment. And when I was doing my work on the vagus nerve and studying the vagus nerve, I was listening to a lecture by Dan Murphy, and he was talking or discussing how the upper 3 cervical vertebrae project afferents into the vagal dorsal motor nucleus, which is the motor aspect of the vagus nerve. Then I went, voila, here we go. When somebody gets an upper cervical adjustment, it does the same thing. So they get this powerful vagal response that will, correct so many things in the human bodies. And I think that in our society, because we're so wound up nowadays, and you, especially as a practitioner, probably see this, how incredibly toxic and neurologically wound up the patients that we're seeing nowadays, that their vagus nerve just gets hammered down, and that perpetuates their toxicity and their inflammation and on and on. So
Right. Of course, everyone's got the shallow breathing, everyone's
absolutely,
completely
yes.
stressed, shoulders up towards their ears. I think we even had someone else talking about that the other day. So as soon as you heard about those efferents going into the vagus nerve, that got you turned on, right? About the
Yeah, that was a big factor in putting together a consistent treatment protocol for treating the vagus nerve, which, like I described in the article, including treating the GABA-1 acupuncture points for the neurotransmitter acetylcholine, treating the temporal bulge cranial fault, and adjusting the upper cervical spine.
Mhm.
So that kind of put it all together for me, and Dan Murphy described it perfectly in one of his lectures. So, of course, you can go on the internet and you see 1,000 different vagus stimulating apparatus now, but I've always contended that, you can stimulate the vagus nerve in a lot of different ways, but unless the vagus nerve is has the appropriate afferentation, as we call it in functional neurology, has the appropriate health and neurochemistry balance, the stimulation, as soon as you stop stimulating it, it's going to go away.
Right.
So we want a permanent correction of it. So you have to look at all different aspects of it, not just continually stimulating the nerve.
And you mentioned that it is cholinergic. Now, how much of the issue with vagal function do you associate with nutritional deficiency? I mean, it seems like B vitamins very commonly are deficient in the common public. Uh,
Well, yes,
is it as simple as supplementing with choline or acetylcholine or lecithin?
in some cases it can be. I mean, I have a particular appreciation for a product that NutriWest makes called Brain Charge, because it's a time release kind of multi choline supplement that works real well for that. Sometimes the patient can have actually too much norepinephrine activity, which is overdriving the sympathetic nervous system, and that will dampen down the vagus nerve because they're contrary to each other, and that person may need more magnesium so their body can metabolize cortisol and break down the extra adrenaline, etc. So it can be the nutritional aspect of it is really important, and it can be a little bit complex.
Mm-hmm.
But in our society, because there's so much stress, there's people commonly have issues with the neurotransmitter acetylcholine. And one of the questions I commonly ask my patients when I'm doing my initial exam is, do you walk into a room and forget why you walked in there? And they'll commonly go, yes, right? And that's a classic sign of a short term memory deficit. You can't even remember long enough to get across your house. And that's your short term memory is primary cholinergic in nature.
Mm-hmm.
And so that's where I start, putting together the picture of what's going on with the patient.
Mm-hmm. Well, and this is why I was going to say, I mean, when we talk with you, especially about applied kinesiology, because this is one of the diagnostic tools to figure out the causes. Isn't that, part of it, like all of the toolkit of what's the cause of
Yep.
all this dysfunction?
Yeah, it really helps you kind of ferret out the muscle testing, and somebody who's really an expert in manual muscle testing and knows how to test in a way that really evaluates neurological function. You can really get to the bottom line cause of what's going on with the patient, because commonly these patients who have vagal dysfunction or any type of autonomic nervous dysfunction will come in with a multitude of complaints. And one time I mentioned to my colleague Lawrence Calderon, I said, we were discussing a patient, and he was
Mm-hmm.
presenting a patient that had just, again, a multitude of things. I said, the more the patient complains about, the least they have wrong with them. And he goes, what do you mean? I said, well, there's something deep down that you have to dig for that's causing that whole plethora of symptoms and complaints. And that's what the muscle testing can, when it's properly applied, can really help you get to that point in the patient. And really, it doesn't mean they don't have something seriously wrong. It's just that typically there's one thing that's causing that whole plethora of complaints. For example, if they come in and they've got memory problems, they've got digestive problems, they're constipated,
Mm-hmm.
they're burping all the time, they're swollen, and on and on and on. It can be just, simply the vagus nerve causing all those complaints.
Wow.
So, you got to be careful when you're a practitioner
Mm-hmm.
to find that underlying cause and not chase complaints.
Well, and this is what I was going to say. I'm thinking where we see the failure in a lot of medicine, MD, because they've got a different diagnostic test for every single one of those conditions.
Absolutely, absolutely. And I have a wonderful story about how I got started up receiving quite a few referrals from one of our local uh, clinics. It's a large hospital clinic, and I treated this gentleman, and he had issues with his stomach, and he was being treated by an MD at the hospital for the same complaint, and using our techniques, we got right to the bottom
Mm-hmm.
line of his problem. He had hypochlorhydria, and got that taken care of. And his MD was so amazed that I figured out what was wrong with him. He actually came to me as a patient to see
Mm-hmm.
what the heck I was doing. And now I treat his whole family and everybody.
Oh my gosh, that's such
Yeah,
a great testimony.
yeah, it was a great story, and
Mhm.
because they couldn't figure it out.
which is scary, right? Because that's, I think, more common than people
Oh
realize.
yeah,
Mhm.
yes,
So now, could you talk, Dr. Belli, about the skill of the manual muscle testing? I mean, this is heavily debated
yeah.
in schools, right? I mean, like, so I came through the program that I graduated from in National in 2006. And of course, they're teaching manual muscle testing, but they're looking for the peripheral nerve deficiency or impingement, right?
Yes, yes. Well, that's just your typical kind of medical approach,
Mhm.
as a manual muscle testing is a diagnostic tool. You can go through any clinical neurology textbook, and they'll teach you, does it have strength 1 through 5 categories, and on and on. Well, in applied kinesiology,
Right.
we use it a little bit differently. Like I said, in my particular treatment protocol, we primarily go for muscle inhibition, and we refer to it as muscle inhibition versus muscle weakness, because muscle weakness means a whole different thing,
Mhm.
as for example
Right.
weightlifting or something like that, where if a muscle's neurologically inhibited, that's another different aspect. Well, we look for these inhibition
Mhm.
patterns, and these patterns help us assess what's going on in the nervous system. And I want to make sure that that's clear from somebody just pulling down on somebody's arm or something like that. These patterns are very well defined patterns. Some of the new work that I've been doing over the last year, and it's really opening up some more treatment avenues, is working with what we call central pattern generators, and figuring out the muscle tests to test these central pattern generators. And what central pattern generators are is they're clusters of neurons throughout the spinal cord, brainstem, cerebellum, and other aspects of the brain that guide our automatic movements. For example, you have central pattern generators so you can walk. So when you get up off the couch to go to the refrigerator to get a beer, once you decide to take that step, your brain takes over, those generators take over, and you don't have to think about every single muscle you move to get from the couch to the refrigerator, or the game would be over by the time you got back. And so we're kind of tapping into those central pattern generators, which again are opening up a whole nother new avenue of, okay, this particular gait pattern generator is not working. What neurology is associated to that? What chemistry is associated to that? What do I need to test and fix on that? So I'm really excited about that, and that's been about a year and a half, 2-year-old project now, and it's really coming to fruition, and I'm having fun with helping patients that I couldn't help before with that kind of work.
Very interesting. Very interesting. I mean, that reminds me a little bit of the tonal parasympathetic effect of the organs and their reflective symptoms in in the musculoskeletal system, kind of viscerosomatic
Yep.
reflexes, right? However, through the cord or much more centrally, it sounds
Yeah.
very interesting. Is there anything you want to talk about on even that, the kind of the viscerosomatic reflexes, or are those a prominent approach?
Oh yeah, and even there's central pattern generators associated to visceral function. And the interesting thing about the whole central pattern generator thing, not to focus too much on one thing, is that probably 10 or 15 years ago in human neuroanatomy, it was still being debated as to whether humans even had these pattern generators in their nervous system. And now, of course, it's done a whole right turn, and they go, oh yeah, we're loaded with them. I mean, we use pattern generators from everything from chewing to swallowing, because you don't have to sit there and think about,
Right.
okay, I need to contract my masseter so I can bite. That's all automatic and taken care of now. And
But when it fits their narrative, they start to buy in and then they take it over.
yeah, well, and that's exactly what's happened in the vagus nerve. I mean, they use a vagal implant on rheumatoid arthritis patients, and that implantation has actually been patented by one of the researchers. So he gets bucks every time
Mm-hmm.
somebody applies that. And they found that these vagal implants can literally cure people with advanced rheumatoid arthritis because it has such a powerful anti-inflammatory effect. So that goes to tell you, I think we're just scratching the surface on what we could do with chiropractic and applied kinesiology and treating vagal dysfunction and other neurological dysfunctions. I think, even though chiropractic's been around for, over 100 years, it's still, we're just such infants in the healing arts, and what we're starting to learn.
Now, is Applied Kinesiology doing any research that we should be aware of, or that have done that maybe didn't get the attention that it needed?
Well, there's been quite a bit of research published, and I'm, as you know, the chairman of the ICAK at this current time, so I'm kind of up on what's going on, and we've got some research that's going to be published soon in regards to some chemical research, and then there's a paper being published coming up about what we call the ventral horn theory, because basically, who's written by a brilliant practitioner, Michael Allen. Basically, what happens when you do a manual muscle test, you're really testing the central integrative state or the function of the ventral horn. That's your motor horn, and then everything that converges on it to set that central integrative state. So that's all beautifully explained in this paper that's being published. There's been quite a few papers published on the validity of the muscle test and inner examiner reliability, and that's kind of, I'm going to say, old stuff now. So now what we're pushing for is more outcome studies, because that's really what
Mm-hmm.
gets you there, and so that's kind of the direction the research is
Right.
going.
And with the tools now, with the outcomes assessment, it's easier probably if you're using
Yes,
something like
yes,
that.
yes.
So very good. So now, with someone that wanted to learn these approaches, how do they go about it? You are the president or the executive director of the ICAK. Or do you offer seminars personally, or webinars, or what kind of?
Well, the ICAK has a whole education program, and we're actually in the throes of redesigning the education program to make it more modern and up to date. And there's a track where you can get a basic certification, which is called a professional applied kinesiology certification. We call it a PAK. Or you can get a diplomate in applied kinesiology, which is a 300-hour program. And then we're starting some more advanced classes or programs that have to do with concussion and functional neurology, functional medicine, et cetera. And those are fellowship programs.
Mm-hmm.
And that's all coming up in the future. If you go to the ICAK USA website, classes that are being taught are always listed there. We have 50-hour courses, 100-hour courses, advanced courses. I teach an advanced course in Kansas City every year that we really kind of push the envelope in that particular. It's a 3-day weekend class, and the people, we only allow 15 participants because we want to really workshop this stuff. And the folks who come into class are already very familiar with the different testing aspects and different acupuncture portions and things of AK, so we can just start on Friday morning and just take off with that class. So that's the one I really look forward to every year, because it's really a brain buster. It's a lot of fun.
Right. It keeps you sharp. When is that typically?
It's usually in April.
Okay.
Yeah.
Well,
Yeah.
let us know.
We haven't set the date for this year. This will be the 7th year of the class.
Mm-hmm.
And it's, after you teach something a few times, you get pretty good at it. So it's
Right.
every year it gets a little bit better,
Good. Well, that's good news. So to the segment of the profession that may be like, applied kinesiology, I'm not buying it, or within our profession, or outside of our profession, what kind of information would you want to share with them, or how would you respond to someone who had kind of a negative impression?
It's, a lot of people have gotten negative impressions by watching people who are not qualified practitioners practice what we refer to as real applied kinesiology,
Right.
and who are just doing, arm pull down muscle tests and
Mm-hmm.
things that aren't directed at any specific things.
Mm-hmm.
Where with the International College of Applied Kinesiology, we're very strict on our standards. We realize how these things can be misconstrued, and we spend a lot of time explaining the neurological aspects of it. And since the CARIC program has come about, there's a lot of crossover between functional neurology practitioners and applied kinesiology practitioners. And so the ICAK, for example, we have an annual meeting every year. This last summer's annual meeting was heavily permeated with functional neurology, and folks taking these different aspects of functional neurology and using manual muscle testing to evaluate them. Because, like I explained earlier, everything we do, as I sit here and talk to you, I'm doing muscle tests on myself. My Italian hands are waving all over the place. My jaw's moving. My pupils are dilating and constricting, and on and on. So we just have to learn how to use these tools to evaluate these different neurological functions more and more in the future. And like I said, that's why I think we're just scratching the surface on what we can do.
Cool. Very good. Jacqueline, any final words here for Dr. Belli? We've got him for about 30 minutes here.
For me, what I was thinking is for applied kinesiology is number one, obviously the cost effectiveness of utilizing applied kinesiology versus any of the other options are going to be much more expensive. So to me, as a patient and as a publisher over all these years and looking for how to identify nutritional and other kinds of health issues, I mean, if I were a doctor, I'd want to have that in my toolkit, because you can use that probably to compare it, right? Back with the more scientific or whatever.
Well, when you compare applied kinesiology with standardized Western medicine, of course, Western
Right,
medicine has its place. If you have a big tumor that
right.
needs to be removed, or you have a broken leg, that's where you want to be. But when it comes to being at
Mm-hmm.
your optimal self and being at your optimal levels of
Mm-hmm.
health and well-being and mental function, et cetera, there's nothing like,
Right.
chiropractic and applied kinesiology, because, we can go through and just pick apart what your issues are, and get them back on track, and then guide you in your way of getting there. And, I've been practicing for nearly 40 years now, and I have
Mm-hmm.
no retirement plan.
Right.
I mean, I love what I'm doing, and like my good friend Sheldon Deal said to me one time, we're dying with our boots on. And I have a practice
Mm-hmm.
that's 100% cash and a long
Mm-hmm.
waiting list to get in. And I don't
Right.
advertise.
Right.
We do
Right.
nothing. We just fix people. And that's the whole beauty of it is, we find that one problem.
Mm-hmm.
Yeah.
Well, and that's kind of why I wanted to make sure on this, because over all the years, really, this is the most cost effective. And for any doctor, there's so many factors that influence somebody's state of health. And when, even with blood tests, you're looking at a moment in time. And that's the nice thing about
Exactly.
energy testing, is where you can go through applied kinesiology type things where you're saying, maybe it's not what I had for breakfast. Maybe it's what I'm thinking about. Maybe it's the time of day, circadian. I mean, when you, or the cellular, like the cell phone towers, there's so many different factors.
There's so many
Energetic.
variables. It's unbelievable. And even more now than there were 20 years ago, by far,
Mm-hmm. Mm-hmm.
and
Yep.
so we're just being bombarded with stuff nowadays. And every year I have to increase my skill level, because every year
Mm-hmm.
patients get more difficult. They're
Mm-hmm.
more toxic, they're more overweight,
Right.
their
Right.
foods are worse, and on and on. So,
No, this next generation is completely different, Dr. Belli. The next generation, I mean, it's tough.
oh yeah. Yeah.
I think the applied kinesiology is teaching, doctors really how to be kind of like the electricians of the human body.
Yep.
You know what I mean? Because you're really just following, and the muscle test, the testing that you're utilizing is just verifying, the condition in
Yep.
that state and time. So,
Yeah.
So, Dr. Belli, we're looking forward to your next article here now.
I'm getting on it.
I know you got a lot going on, but not too much. You got to keep you busy, man. We got to keep those boots on.
Okay. I will be on it.
and actually with that, before closing out, the question I would have too then is if you have an idea with practicing chiropractors about how many, is it in the hundreds, thousands, tens of thousands who currently are trained in and utilize applied kinesiology in their practice?
Well, that really is a good question because there's been surveys done, and I actually saw a survey um, that from some time back that said even though these folks don't claim to be practicing applied kinesiology or who are not members of the International College of Applied Kinesiology, there's probably tens of thousands, maybe 100,000 practitioners who actually use muscle testing as a part of their evaluation system.
Right.
So no telling what the numbers are, and so it's manual muscle testing is way more commonly used than you would ever imagine.
Right.
Even in very kind of, I'm not going to say strict chiropractic practices, but boy, I have people all the time I run into say, yeah, I use this particular test. Look at this test. This is what I use for this. And they're not practicing AK per se, but they're maybe practicing some sort of gait thing or something to help them adjust somebody. So,
well, and then through the ICAK, about how many do you have? Hundreds of hundreds, thousands.
Well, ICAK has just shy of 500 current members. We would love that to grow, of course, because our power is in numbers. But over the years, I mean, we've probably had, thousands of members, and so it's an organization I'm very fond of, and I've been a member for practically since the day I got out of school.
Amazing. Now, then, do you have like a finder site? So if a doctor or if somebody wants to find a doctor who utilizes ICAK?
Yeah, ICAKUSA.com.
Okay.
Yeah, and you can just go to the and we're going to redo the website this year. It's a little bit antiquated. So at our last board meeting, we launched the process of modernizing our website, making it more user friendly. Because as you all know, your website's antiquated after about 2 years.
Right. I know. Those digital people.
Very good. Well, this has been outstanding, Jacqueline. I think we're running long on this.
Well, I tell you what, it was wonderful talking to you too, and I'm glad to get to know you a little bit better. And I'm pondering my next topic.
Perfect. All right. Well, let us know when you're ready.
Okay, good deal. Well, I'll be thinking about that too, Richard. So I might be giving you a call.
Thank you for your time. You have a great rest of your day.